Good morning. So, still on diabetic complications, we've looked at two complications on diabetes, which is DKA and HSS. Okay. Now, let's look at so both of them are hyperglycemia, which means that the blood sugar is elevated. So, what about hypoglycemia? So, my question to you is, if you have two patients and one of them is in a hyperglycemic state and the other is in hypoglycemic state, which patient would you want to see first as a nurse? Okay, so I assume that we all know that we want to see the hypoglycemic patient first, because a patient will likely go into serious complications with hypoglycemia faster than hyper. Okay, because a patient can sustain high blood sugars for some time before major complications, but hypoglycemia is very dangerous. So we want to see those patients that are hypoglycemic first, and we want to attend to them like promptly. So what are some of the signs and symptoms of hypoglycemia? Um, we'll have your patients could be sweating, okay, um, feeling like lethargic, they're drowsy, they're not coherent. So confusion, light headache, just those are just some of the key things. So if you've given a patient insulin, and then say like a fast acting insulin, then you go back to assess the patient maybe uh, 30 minutes later, or you notice that the patient is now drowsy and just slow to respond, they could be in a hypoglycemic state. Okay, so you address that promptly. So make sure your one of immediate action will be check their blood sugar. Okay, assessment. Okay, as nursing assessment, just check the blood sugar. And if, of course, if it's hypoglycemia, then we want to administer any kind of fast acting carbohydrate, quick sugar. Okay, and we'll administer quick sugar if your patient is alert and oriented. I recently had a patient that the blood sugar was in the 30s, but this particular patient was talking to me. She actually called me to come. She said, I feel like my blood sugar is low. Can you check it? So when I checked it, it was in the 30s. Okay, so that patient was alert and oriented. I could give them something to eat because I know they are alert and oriented. uh but if your patient is unconscious, or they are, you can't keep them awake, then you give them dextro. Okay, IV dextro. Okay, if they're unconscious and you're not really arousable, you can give them IV dextro. But for your patients that are alert and oriented, you can give them the fast caps. So if you give insulin, this is just a tip. If you give insulin, then a few minutes later, you suspect signs and symptoms of hypoglycemia, please just go ahead and check their blood sugar and address it immediately. So that will be it for hypoglycemia. Be comfortable with the signs and symptoms of hypoglycemia and know how to address it. And then I'll just here I would like to cover a little bit on patient education when it comes to hypoglycemia or hyperglycemia. I'll just combine it. So if there's some rules like sick day rule, right? Okay, so never stop a patient's insulin because uh they no, let me take that back. um so for signs and symptoms of hypo or hyperglycemia, um i just I just want you to know that treat hypo, low blood sugar, like a priority. Okay, treat low blood sugar as a priority over high blood sugar. Okay. uh what about insulin pumps? What are some of the insulin pumps? So for insulin pumps, there are two things I'd like you to remember. Is like the bolus rate and the basal rate. Basal rate is like the continuous rate. The bolus rate is like um you just give a certain amount of insulin at one time. So whether it's so go back to your textbook and read and know the difference between the bolus and the basal rate. So we'll do for our insulin pumps. So your patients, some of your patients will come to your acute care settings with already having their insulin pumps. So if they have their insulin pumps, follow your facility protocol for that insulin pump. What is your facility saying? How should you manage that pump? General rules is that is if the patient is alert and oriented, they know their pump, they're comfortable with the pump, they can manage it. Most hospitals will say let them manage it because they're alert and oriented. If the patient shows any signs of confusion, they cannot keep that pump. Okay, we'll have to take that pump out and manage them per that hospital protocol. So look at your facility protocol when it comes to insulin pumps. But like specifically for patient education, know that we'll adjust the dose, the bolus dose after meals. Okay, we'll adjust the bolus dose after meals. We want to change the insertion site every 2 to 3 days. You want to change the site, and also know that the pump will deliver like a basal insulin. It's like 24 hours a day. So the pump delivers the basal insulin 24 hours a day. So it's like an ongoing thing. So always assess the patient's ability to manage the pump. Okay, and you teach the patient how to calculate and their doses, how to calculate and correct their insulin doses based on the insulin. Most of these patients, the diabetic educators have been consulted and they have like good knowledge about the pump to manage the pump well. So if a patient is we'll teach them also exercise guidelines, okay, to monitor their blood sugars if they're about to like do like vigorous exercises, because when you exercise a lot, of course they can go into a hypoglycemic state. And then sick I want you to go back to your textbook and look at the sick day rules. Okay, we'll never stop an insulin we'll never stop insulin just because they're sick. Because think of it, if a patient is sick and they are not eating, they could have an infection. An infection will cause the blood sugar to be elevated. So if you are not giving a patient, if you were not administering insulin because the patient is not eating and they are sick, they could still be in a hyperglycemic state. Okay, so those are just some highlights of the insulin pump. Again, follow your facility protocol when it comes to insulin pumps, and make sure that you're adjusting the bolus insulin after their meals. We'll make sure that we're changing the site of insertion every 2 to 3 days. Okay, we're making sure that the patient is coherent enough, they have the ability to manage the pump. If they don't have the ability to manage the pump, they cannot keep the pump while they're in the acute care settings. And if they are going home, we cannot if it's a new pump, before they discharge home, they must have had a good education on that pump, on how to manage it effectively. Okay, I think I'll end right here.